Hi, Dr. Jordan here. I wanted to touch on a common finding postpartum and a really quick and easy exercise, if you will, to correct it. So when an individual is pregnant, obviously there's a lot of stretch that occurs. And one of the areas that really expands in pregnancy is our rib angle here, right? And so our rib angle is where the bottom of the sternum is, and it goes underneath the very bottom of the rib cage here, okay? And so that rib angle on average is about 90 degrees or so when we are at a healthy baseline. When we go through pregnancy, that rib angle widens, obviously, to allow for a baby to grow and expand. So one thing that happens postpartum is even though baby is no longer inside the body, that level of stretch or expansion is often still there postpartum. And so what we want to do is help to train the muscles that go along kind of the rib cage area, so part of our core, help them to retrain back to a more normal resting position. So one of the things I like to do is take my hands kind of on the bottom of my rib cage here, and I like to focus on a relaxed breath in, and then focusing on like kind of a nice forceful exhale, if you will. So a nice And what you should see with my hands, which are resting on my ribs here, is that they expand when I breathe in, and when I exhale, those muscles are helping to kind of pull my rib cage together. I'm not bending over and crunching, right? I'm just creating that movement through the rib cage itself. So again, that looks like if you're postpartum and you're noticing some widening of the rib cage area, this is something that you can start to incorporate, and this can also build on other exercises later on.